Welcome to Arirang Live. It's after 2 p.m. here in Seoul, and I'm Kim Dami. In just a minute, we're going to cross over to the latest briefing from the South Korean health authorities on the COVID-19 outbreak. Before we came on the air, we learned that South Korea has confirmed 39 new cases on Saturday. Around 70% of them are from the metropolitan area, but the rest emerged from other big cities, including Daegu and Busan. That takes the total number of cases to 11,441. With no additional deaths, the death toll remains at 269. Around 10,400 people have fully recovered and been sent home. South Korea's Central Disaster and Safety Countermeasure Headquarters on Saturday has once again urged citizens to follow quarantine measures, including refraining from visiting regularly crowded places like shopping malls and cafes. In fact, the government has suspended operation of public facilities across the metropolitan area until June 14. Moderna has announced Friday it has entered phase 2 of vaccine clinical trials for COVID-19. The mid stage of the vaccine intends to enroll 600 patients, and the first group of participants have already been dosed with the vaccine candidate. Earlier this month, Moderna released positive results for the phase 1 study, showing that participants have developed antibodies against the virus. There are currently around 10 vaccines for COVID-19 that are under clinical tests on humans. Experts predict that it could take from 12 to 18 months for a safe and effective vaccine to be developed. The Trump administration has announced that the U.S. will end preferential treatment for Hong Kong, a move that could further damage U.S.-China relations. U.S. President Donald Trump said Friday that Washington would revoke Hong Kong's favored trade status and revise its travel advisory for Hong Kong. The retaliatory measures come in response to Beijing's passing of a controversial national security law in Hong Kong. In response, China's Global Times newspaper denounced the move, saying it's a recklessly arbitrary step that will eventually backfire on the U.S. On the same day, the U.S. and Britain discussed Hong Kong at a closed virtual meeting of the UN Security Council. The EU has also expressed grave concerns over the law. The briefing has just begun, so let's take a listen.
Let us now begin our regular briefing for May 30th, Saturday, on the COVID-19 response. We have 39 new cases today, and the total number of confirmed cases stands at 11,441. This includes 1,247 imported cases from overseas. Of them, 87.87% are South Korean nationals, and we have 35 more people making full recovery, and a total of 774 people are in quarantine undergoing treatment. We have no additional fatality today. Out of the 39 new cases, 12 are imported cases, while 27 are local transmissions. Of the 12 imported cases, 3 are from Europe, 3 from America, and 3 from UAE, 2 from Pakistan, 1 from Bangladesh. And next is some updates and close look at our domestic infections. At the Kupang Logistics Center in the Bucheon city of Gyeonggi-do Province, a total of 108 confirmed cases have been reported so far. And we are conducting these testings for all workers who have worked at the logistics center since 12th of May, and we are also putting them on self-quarantine. And of the confirmed cases, 73 are the workers there and 35 are the contacts. And 47 are in Gyeonggi-do Province and 42 are from Incheon. And also at Gwangju of Gyeonggi-do Province, we have a Happy Nursing Hospital. One person of the caregivers have been showing symptoms and has been confirmed positive. And we also did additional diagnostic testings, and a total of 5 people have been confirmed from this specific cluster. Also in Seoul, we have the Yonsei Naro Academy, and we confirmed that a family cluster infection has been breaking out in the Incheon city, and this has been also one of the contacts of the confirmed case from the academy and was operating the real estate agency. And also in relation to the nightclubs, we have, as of compared from yesterday, we have 3 more cases, and now the total stands at 269. Here at the KCDC, we are seeing an increase in the cluster infections among the metropolitan area. Therefore, we ask the members of the public here in the metropolitan area to refrain from going outdoors and gatherings. If you have to go outside and you have to attend a gathering, please keep 2-meter distance and please wear your face mask. Please do not handshake and also keep your personal hygiene measures as well. And we highlight this multiple times, but COVID-19 is also very prone to people above the age of 65 and the people with chronic illnesses. And we ask these high group people to refrain from going to crowded and enclosed spaces. And if you have to visit these places, please wear face masks. In addition, we have a few words for the public. The quarantine authorities, we see that you also understand through the numbers, but on the surface, we are seeing a decline in the number of outbreaks here in the metropolitan area. However, there are still many cases whose infection sources are not identified. And also, we have a cluster infection in the Bucheon city, which is also posing great risks of local transmissions. And we highlight this multiple times. As the size of infection becomes bigger, there would be many people who will be put at risk, including the religious facilities, the hospitals, and nursing hospitals. And the coronavirus can also attack these facilities, which could lead to a wider range of cluster infections and an increase in our death toll. And because the metropolitan area is highly densely populated, it is also very dangerous. And we have learned some lessons from the latest outbreak in the metropolitan area. We have learned that you need to cooperate fully with our epidemiological investigation. And if you have suspicious symptoms, you need to get tested as soon as possible. And also, you need to keep an entry log of all visitors, and all of the basic quarantine rules need to be strictly abided. These are some of the lessons that we have felt so far. And looking at the latest outbreak in the metropolitan area, we also say that all of the high costs that we are paying right now should not be in vain. On the other hand, there are also some aspects that I would like to mention. There were some large facilities, including the Samsung Medical Center. We identified that there were no large cluster infections, even they had an outbreak, a confirmed case of COVID-19. So you could be very concerned and nervous of another COVID-19 outbreak, but this shows that we can effectively curb further outbreak going forward. So in the end, it is very important to identify the diagnostic testings and patients at an early age, and also this needs to be backed by the practice of social distancing and distancing in daily lives by our people. Disinfection, ventilation, and keeping good hygiene are some of the most effective measures in curbing the virus. In the world after COVID-19, COVID-19 outbreak, and as one of the officials at the KCDC, my honest words is as follows. There are some places that can also have difficulties in managing quarantine facilities, and if the COVID-19 outbreak begins and lingers, we believe that these facilities cannot be opened for the public any longer. And unfortunately, many of the people who were infected by the virus also are the people who have been working very hard lately, even on part-time. And we ask all of the owners and employers and the runners of the business establishments to continue to keep strictly to and abide by the quarantine guidelines. And if you are the owners and managers of these crowded the business establishments, we ask your participation as well. We keep urging you, and we continue to carry out our inspection, and we are putting intensified quarantine measures. Maybe this is a moment where we could be implementing a new revision and new improvement to our quarantine guidelines. We tell this you will tell this multiple times, but if you are the owners of these businesses, please let your workers abide by the notion that they need to take a rest at home if they feel sick, and please let them abide by basic quarantine rules, and let our quarantine guidelines be implemented on over your business establishments. Maybe on a financial cost aspect, it could incur some of the costs. However, this could also translate as an opportunity to get yourself ready for COVID-19 quarantine. So these are some of my last words. Thank you very much.
There you have it. Arirang will bring you the next briefing on COVID-19 live tomorrow afternoon. That's it from the News Center for now, but we'll be back with our 6 p.m. regular newscast. Bye for now.